All right, so this video is going to be about nutrition when your patient has cancer, HIV, or AIDS. What is key? We're going to talk about these disorders together because they're very similar. The key here is wasting and malnutrition are common characteristics that we see with these disorders. So we're going to want to make sure we're assessing for those things. So first and foremost, what is the goal? The goal is the same for all three disease processes, is to improve survival rates, reduce treatment side effects, and increase quality of life. So we're going to talk about that in detail now. So first and foremost, if you're not aware of what cancer is, you can read the slide here. It's telling you the definition of it. It's actually the second leading cause of death. We see most of it actually in older adults. And we can actually, I think this last point is very telling, is that 50 to 75% of all cancer deaths can be linked to human behaviors and lifestyle factors. And a lot of those are going to be nutrition. So that is why it's so important to be doing primary and secondary prevention to prevent the cancer from occurring. And then even when your patient does get cancer, nutrition is going to still play a vital role in their management of the disease process. And let's talk about that further. So first and foremost, how can we prevent cancer? So you can obviously read these on your own. So what are some things that we're going to do to help patients with these? Is, well, one, we want to encourage foods that are high in antioxidants. We're talking about, again, that's the vitamins C, E, and beta carotene. As well as we want foods high in phytochemicals like broccoli, onions, grapes. For the great majority of cancers, these lifestyle factors lifestyle factors and environmental exposures become the major risk factors. For example, number one on there, not smoking. If everyone in the United States quit smoking right now, future cancer totals would drop by a third. So 1/3 of all cancer would be eliminated in the United States alone if simply everybody stopped smoking. Then other things like, for example, colon cancer and breast cancer are linked to a lack of exercise. So you can see how that ends up being on the list here. And mouth, throat cancers, and breast cancer are linked to alcohol take. So you can see we want to limit alcohol beverages. So we want to make sure, again, remember that you know what constitutes one alcoholic beverage. Because for women, they should not have more than one alcoholic beverage a day. For men, it's not more than two. So altogether, about 30 to 40% of cancers are going to be influenced by diet alone. So like I mentioned here, phytochemicals and antioxidants are very important. You can see here antioxidants are going to help prevent cells from being oxidized. For example, if you should already remember what are good food sources for vitamin C and vitamin E. If not, I encourage you to review in your ATI and Grodner text. For beta carotene, that's the precursor to vitamin A. That is going to be found in things like sweet potatoes, winter squash, carrots, red peppers, dark green vegetables, cantaloupe. A lot of orange foods. Phytochemicals. These are, the definition here is they're non-nutritive substances found in plant-based foods that appear to have disease-fighting properties. And I gave you, for example, broccoli, grapes, and tomatoes all have phytochemicals. There are hundreds of these. We're not going to go into the specifics, simply knowing that you're going to want to encourage foods that are high in phytochemicals because they have been linked to decreasing cancer as well as helping with the incidence as well as the morbidity from cancer. All right, let's talk about cancer cachexia. So you can see this is cachexia is malnutrition and wasting of lean body mass. So what we're going to see here is they're just going to be skin and bones. They're going to be loss of those skeletal muscles. We're going to see this by when we weigh them. We're going to be seeing losses in weight. They're going to have a lack of appetite or anorexia. At the same time, they're at a hypermetabolic state. So they're, because remember, those cancer cells are usually dividing very rapidly, and it takes a lot of calories to keep those cells going. And those cells, we don't want that to happen, but those cells are going to take in those calories no matter what. So since this patient is in a hypermetabolic state, we need to give them more calories, more protein. This actually happens in almost 50% of all cancer patients, so it's very important that you are assessing for this and understand what this looks like. Then let's talk about side effects of chemotherapy and radiation, which are common treatments for cancer in addition to treatment through surgery. So with chemotherapy and radiation, We see things like anorexia, also known as loss of appetite, nausea. This can actually be anticipatory nausea. We also see things like vomiting, stomatitis, which is painful mouth sores, loss of taste sensation, decrease in saliva production, and diarrhea. We're going to talk about those some specifically. So for anorexia, what are some possible interventions? You've identified your patient as having a lack of an appetite. Um, let's do things like have small, more frequent meals, making sure we get nutrient-dense foods. We may need to even use some high-calorie supplements like a Boosts and Ensures. We're going to want to encourage those foods to be consumed first. We could also do things like fluids between meals. For nausea, like I said, this can be anticipatory. What that means is just the sight of food can make this person nauseous, or just the smell of the food. So what we're going to do is we're going to need to do what's called aggressive antiemetic therapy. This is going to be the first line of treatment. What this means is with these patients, we're actually going to give them anti-nausea medications before they even complain of nausea. Ideally, 30 minutes before they have, 60 to 90 minutes before a meal. We want to prevent them from even having anticipatory nausea or vomiting. Other things that can help with nausea are going to be cold foods without odor, limiting liquids at mealtime, and avoiding highly seasoned foods. And then stomatitis, which I said is painful mouth sores. Things we're going to want to do there is encourage soft, easy chew foods and avoiding acidic foods, like citrus is a big example. So think about what would be some good foods that you would want to encourage somebody who does complain of painful mouth sores, foods that they could consume to make sure they're getting enough calories and nutrients without the painful side effect. All right, let's talk about a special type of cancer patient known as the bone marrow transplant patient. These patients are going to be often immunosuppressed because we want to prevent them from rejecting their new bone marrow. However, any patient who's immunosuppressed, and in this case the BMT patient, this is going to make them more susceptible to infections and foodborne illnesses. So I want you to think back to those things that we did, that we talked about with food safety, such as things like avoiding undercooked eggs, undercooked meat. We want to make sure that they're washing their fruits and vegetables very carefully. Some hospitals will actually not even allow any fresh fruits and vegetables, only allow canned vegetables because those are going to not have as much, going to be less likely to have foodborne illnesses in there with them being canned. We're going to also want to put them on what's called a low bacterial diet or a neutropenic diet. When their neutrophils are less than 1,000, when those neutrophils get less than 1,000, we're going to actually put them on what's called a low bacterial diet or a neutropenic diet, which is going to then have things, it's not going to have like runny eggs, for example, because those are over easy eggs, because those are at too high risk for this patient because they cannot fight off things that you and I would normally be able to do. All right, then let's move on to HIV/AIDS. This slide is just giving you a definition of what those mean. And again, the key here is these patients have a decreased immune function. So let's talk about, because they have a decreased immune function, what are we going to do? Well, first and foremost, we have this special kind of malnutrition called AIDS-related wasting syndrome. So make sure you understand what the definition of that is, which is an involuntary weight loss of greater than 10% in 1 month, and there must also be the presence of either chronic diarrhea, weakness, or fever over that month. So AIDS-related wasting syndrome, again, is an involuntary weight loss of greater than 10% in 1 month, with also signs and symptoms of either diarrhea, weakness, or fever. This can be caused by things like lack of appetite, fatigue, fever. A lot of medications have side effects. Excuse me. Many medications have side effects that can limit someone's appetite. You can read the other ones there as well, but you can see all of these things are things that can make malnutrition worse or put a patient at more high risk. So you want to be assessing for all these possible causes for this patient, as well as thinking about ways that we can help eliminate that. So here they are. So nutrition therapy for someone with HIV/AIDS is going to be nutrient-dense food and beverages. So once again, having them do things like drink milk versus water with their meals. Have them eat in this case, we're going to do things like put gravy on the meat because that's going to get some more calories in there. We're going to do things like have them eat the meat first, like the hamburger first. We're going to want them to have 5 or 6 meals a day, and 5 to 6 meals plus snacks a day. So maybe that might be 3 meals and 2 to 3 snacks throughout the day. We really want to try to fortify foods with extra calories and protein. So for example, with that milk, let's have them drink whole milk or have them drink a milkshake versus skim milk or water. Again, we're going to encourage cold or room temperature bland foods. We're going to try to avoid greasy foods and foods that contain yeast. The reason why we want to avoid foods that contain yeast is because we want to help prevent fungal infections. Again, we're going to use those high-calorie supplements just like we did with cancer. We're going to protect them against foodborne illnesses by teaching them how to prepare their food properly, by making sure that they cook meat to proper temperatures, making sure they wash their fruits and vegetables beforehand, making sure they wash their own hands before. Don't use the plate that they had the raw chicken on to now cut up their fruits and vegetables, making sure that they refrigerate properly. We want to prevent dehydration because if they're having diarrhea or vomiting, they're going to be at high risk for dehydration. And this patient, we're actually going to have them take a supplement that has 100% of the vitamins and minerals they need. This is one of the rare times that we actually are going to encourage supplement use. And then lastly, what I wanted to talk about here is that the presence of malnutrition and weight loss is a very important predictor of an HIV and AIDS patient's morbidity and mortality. When your patient has a BMI of less than 18, it is associated with increased risk for death. So what ends up happening is once a person becomes malnourished, the malnutrition worsens the disease, which in turn then worsens the malnutrition. So we end up getting this destructive cycle begins where the more drugs become necessary. Many of them end up impairing nutrition status further. And then we need such treatments like surgery or radiation, and those are going to take a further toll on the patient. So really nutrition management is very key in both the cancer and HIV/AIDS population to improve the quantity as well as quality of life for these patients.